Hello, everyone, and thank you for joining our program today. We are so excited to be here and celebrate Myeloma Month with you. My name is Ellie Darrow, and I am the Nutrition Program Coordinator for Blood Cancer United's Nutrition Education Services Center, which is also referred to as NESC. We hope you enjoy the webinar that we've planned for you. I am proud to introduce Dietary, Microbiome, and Metabolism Evidence in Blood Cancers with a focus on myeloma. Throughout the presentation, you'll see web pages, resources, and recipes for you to explore. We will email the presentation and slides shortly after the program today. It will also be available on bloodcancerunited.org and bloodcancerunitednutrition.org in the coming days. Next slide. The Leukemia and Lymphoma Society is now Blood Cancer United. You may still see links, pages, or emails referencing our previous name. Please know that we are still the same organization with the same mission. Thank you for your continued support during this really exciting transition. Next slide. As I mentioned earlier, the NESC is your hub for all things nutrition. We proudly offer free nutrition consultations with our dietitians over the phone for patients with any cancer type. We also provide a wide range of free print, video, and audio materials on our website, bloodcancerunitednutrition.org. We'll share more details about these offerings at the end of today's program. Next slide. We would like to share a quick disclaimer. The Nutrition Education Services Center is for information purposes only. It is not intended to substitute for the advice of your healthcare team or provide medical diagnosis, treatment, or therapy. Please consult with your healthcare team before making any changes to your medical plan, diet, or physical activity. Next slide. I'm now pleased to introduce Dr. Urvi Shah. Dr. Shah is a lifestyle medicine certified hematologist, oncologist, and physician scientist at Memorial Sloan Kettering Cancer Center. Her research interests include modifiable risk factors, diet, metabolism, and microbiome in cancer. She leads to the NUTRIVENTION dietary intervention trials in patients with cancer and precancer states that will collectively enroll over 600 participants. Results from the first NUTRIVENTION trial have been published in Cancer Discovery and showed that a high-fiber plant-based diet improves key cancer risk markers and may delay progression to the cancer myeloma in patients with precursor plasma cell disorders. Thank you for being here, Dr. Shah. I'll pass it off to you.
Thank you so much for the invitation. It's great to be with you all today and excited to talk about this topic. We look forward to questions as well at the end. So these are my disclosures. I think what food or supplements can I take is one of the most likely asked questions by patients and also the least likely answered by oncologists. And I think most of you would agree that diet and nutrition research infrastructure to support patients in cancer is really an unmet need. Just bringing a case of a patient who had a myeloma and had all these medical problems. And whether we agree or disagree whether nutrition directly impacts cancer, I think we can all agree when there are so many medical issues, it affects the ability to get all treatments. And when we cannot get all treatments, that can reduce overall survival. So therapies like transplant, CAR T cell, many trials. What I've marked in green are things that potentially could be prevented through lifestyle changes or at least partly reversed. I want to talk about first a few metabolic aspects and then move over to the microbiome, the immune system, and then lastly go over some of our trials ongoing in this space in the prevention, treatment, and survivorship settings. So myeloma is one of the cancers associated with an elevated BMI amongst the 13 that have clear evidence. And when we estimated, this is just a mathematical study where we took the estimates of what is the prevalence of myeloma and elevated BMI, and we think that approximately 10 to 17% of myeloma cases could be attributable to elevated BMI. in terms of a risk factor as causing them. So it's not a small number, but somewhere between 1 in 10 cases to 1 in almost 5. Obesity and elevated BMI can affect the risk of myeloma through multiple mechanisms. And here you can see bone marrow adipose tissue. The adiponectin, leptin are markers of insulin resistance, inflammation, the insulin axis, and then also hormones can affect the development of this cancer. And all of these are associated with obesity. Another metabolic condition that we don't think about as much being associated with cancer is diabetes. And I think for myeloma, the data is not as strong as obesity, but you can still see that diabetes can increase cancer risk, maybe because the same things that cause diabetes might also cause cancer risk, such as genetics or the diet or the weight or age. But it could also be that all of these factors are raising blood sugar and blood insulin, and those are growth factors for the cancer. When a large population study was done from Canada, they showed that patients with diabetes had about a 10 to 20% increased risk of blood cancers. So there is this association with risk and mortality. This study also not in myeloma or blood cancers, but just looking at risk of a cancer in type 1 diabetics. So type 1 diabetics meaning that they're just looking at insulin dose, because type 1 diabetes is not really related to like metabolic, it's more hereditary. And you can see even the insulin dose in type 1 diabetes affects risk of cancer, and those with the lowest dose are most likely to be cancer free compared to those with the highest dose group, suggesting that insulin could potentially drive risk of cancer. And if we can lower the dose of insulin we need if we have diabetes too, maybe that could potentially improve outcomes. Here is a study we did looking at patients with myeloma who have diabetes versus no diabetes, and you can see that those that have diabetes actually do worse. So if we can again address diabetes to bring it under better control, that could impact survival potentially. And we looked at this in mice, where the mice with diabetes had much faster growth of the tumor than mice without the diabetes, suggesting again that the insulin levels and the progression could be driving this. Next, looking at dietary patterns, one of the first studies we did was looking at asking patients who were over 400 patients who had either MGUS, smoldering myeloma, or multiple myeloma, and said, since your diagnosis, have you had questions? And the majority did. Their oncologist did not address it, and if the oncologist gave recommendations, majority said they tried to follow them, suggesting that it is an opportunity where we can discuss these topics and really make an impact. Also, patients on their own seem to be making changes. So I think after a major diagnosis like a cancer or precancer state, patients who responded said they actually increased consumption of healthier foods and reduced consumption of unhealthy foods, suggesting that whether we give guidance or not, people and patients are making changes. So it would be important to discuss these topics. Very recently, just last week, we published this looking at over 400 individuals with plasma cell disorders, where we asked them to complete a questionnaire online about the detailed dietary patterns. What you can see here is that patients with a higher BMI had significantly lower diet quality. And the higher the score, the better the diet quality. So you can see here that it's lower. And also their fiber intake was lower, suggesting that here there is an opportunity to improve diet quality by addressing some of these aspects. Majority of participants on our survey also had not heard about the World Cancer Research Fund guidelines. And in case you haven't heard about them, I encourage you to look at them. But 6 out of 10 of these guidelines, these are not specific to blood cancers, but in general for cancer prevention and survivorship or risk reduction, 6 out of the 10 guidelines are really around diet, and you can see focusing on whole grains, vegetables, fruits, and beans, limiting fast food, processed foods, and limiting consumption of red and processed meat, sugary drinks, and then alcohol. And supplements, they do not recommend using that as the sole mechanism. I think more important is the lifestyle aspect. Many people have questions around a ketogenic diet versus a plant-based diet, and I think some of you had asked that question too. You can see here that we published this paper looking at plant-based versus ketogenic diets to look at what are the mechanisms around which they may affect cancer risk. And what you can see here is that plant-based diets are rich in fiber and increase microbiome butyrate production, as well as they have these flavonoids, which are um, uh, chemicals reducing inflammation and have anti-cancer effects. They also reduce time in the colon and help move the bowels forward and have regular bowel movements. Because of all of this, there's reduction in inflammation. Another mechanism is through weight, reduction in weight, improvement in insulin levels, insulin like growth factor levels, and reduction in inflammation. And then thinking about a ketogenic diet, remember one thing, that all healthy diets are going to have a reduced refined carbohydrate intake. So with a plant-based diet, there is a lot of complex carbohydrates, a whole food plant-based, because you're focusing on fiber-rich foods as well. Whereas with a ketogenic diet, because they're aiming for achieving ketosis to get the effect of these ketone bodies that may have anti-cancer, anti-inflammatory effects, what you see is that the participants or patients need to be in really not physiologic but extremely low levels of carbohydrates. And a low carbohydrate diet will not lead to ketone bodies. To reach a ketogenic diet, the carbohydrates have to be extremely low, and that can be challenging for people to sustain because it's not physiologic. But you can see that some of the mechanisms are similar, and you can think about ketone bodies and butyrate as both similar molecules having effects on the immune system and cancer. However, despite population studies showing us that majority of about cancer risk is reduced by about 15 to 20% in those who eat more plant foods, it seems like there are more ketogenic trials going on. And that was what we wanted to highlight in this paper and explain mechanisms around it. The fasting mimicking diet is one that is basically trying to eat within, or fasting or intermittent fasting is eating within a certain window or reducing calorie intake. And you can see here that it may also increase ketone bodies and reduce inflammation. Another aspect is the microbiome, and we are more microbiome than human cells. So I think it's really important to think about what the microbiome wants. And I think fiber is food for the microbiome and really central to it. So you can see here how the microbiome is central to health and disease. Microbiome diversity. So think about a rainforest versus a plantation, and think about the microbiome that's healthy being more like the rainforest, and an unhealthy microbiome more like a plantation. And so higher diversity, which is more like a rainforest, has been associated with better survival in many studies. So is it possible to change the microbiome with our diet and lifestyle? And if you wanted to do this, dietary patterns could be one way to do it. We're going to pause for a minute to do a few questions as a poll. So we're going to have the first question pop up. If you could answer, how many types of plant foods do you eat per week? So thinking about beans, seeds, nuts, fruits, whole grains, and vegetables. We wouldn't count if you eat broccoli 30 times in a week, that's still counted once. So it's more of the variety or the types of plant foods. We'll keep it for another 30 seconds. So we've got a pretty good number of responses now at over 250, so we can end the poll. But you can see that the majority have only 6% are over 30 at this time. So here are the results. If you can see, only 6% of you who responded say that you eat more than 30 types of plant food per week. So we have one more question for you. Which food has dietary fiber? Okay, we can end this poll too. I think the majority of you got this correct. You can see the results where majority said legumes. Remember that fiber only comes in unprocessed plant foods. So eggs, yogurt, salmon do not have fiber. Just something to keep in mind when you're thinking about sources of where to get dietary fiber. So moving on, how many different plant foods do you eat in a week? And I think from the poll, we see that the majority get less than 30. But I want to show you a study that shows that if you can get more than 30 per week, you have better microbiome, short chain fatty acid fermenting bacteria, and less antibiotic resistance genes based on this study. And so if you can try to aim to get this variety, it is going to be helpful for microbiome health. Another study looked at foods that affect the microbiome and immune system. And in this study, what they did is they had participants, these are not patients with cancer, healthy individuals who were asked to basically just increase fiber intake for 4 weeks. And you can see that there was a change in the microbiome function, there was a change in the immune responses, as well as they did another study where in the same study they did another part where they asked these participants to only increase fermented food by 6 servings per day, and they were able to show an increase in diversity, reduction in inflammation, suggesting that diet over short periods can already start making differences to the microbiome and immune system. So going back to the question around vegan diets and ketogenic or a plant-based diet and a low-carb diet, a plant-based would be a low-fat diet. So this study, which was done at the NIH in a clinical center, basically patients were admitted and for 2 weeks, they were either put on the low-fat diet or 2 weeks the low-carb diet, and then they were switched to the opposite. What they saw is that actually both groups lost weight because if you are reducing refined carbs and other unhealthy foods, it's going to help. But you can see that the low carb diet group, which is the ketogenic, may have lost a little more weight than the low fat, but both groups lost weight. But when you look at what kind of weight did they lose, you see fat-free mass was lost much more in the low carb group, and fat mass was lost in the low fat group. What fat-free mass means is it's either protein or it's either muscle or water, because they're not losing fat, and those are the only things you can lose. So I think in a cancer population, this concerns me too a bit, to be losing possibly muscle and fat and water, whereas losing fat, I think we can all agree is more beneficial. So they also looked at immune system changes, and both diets led to the immune system changing within the short period of time. However, there was a slightly more shift with the ketogenic diet around different pathways in the immune system, and the vegan diet was around more of the innate immune system or immune pathways associated with even viral immunity. Next, if we look at infections and diet, and I think this is important for patients with cancer given increased risk of infections too, you can see that patients here, this is actually healthcare workers during the COVID pandemic, they looked at dietary patterns and risk of COVID. And you can see that those healthcare workers who are following mainly plant-based diets, which were higher in vegetables, legumes, and nuts, actually had lower odds of moderate to severe COVID compared to the low-carb, high-protein diet groups. Another study looking at this in over 500,000 participants also showed that those who had healthier plant-based diets were associated with lower risk and severity of COVID, again suggesting that diet may affect infection risk too. So thinking about population studies in dietary patterns and myeloma risk, there have been a few studies looking at just large populations of people and saying, okay, what's your dietary pattern? Let's follow you for decades and see who gets more or less cancer and then associate that. Now, these studies aren't perfect because there are so many different factors that could be included. Maybe somebody who eats healthy also exercises. But if many studies are saying consistently the same thing, I think it cannot be ignored. And usually these studies do adjust for all these other factors like exercise or other aspects. This study from the UK looked at participants and broke it down into groups of vegans, vegetarians, seafood eaters, and meat eaters, and showed possibly a 77% lower risk of myeloma. However, the number of patients who actually got myeloma was very small number. So it is hard to know, like, is this effect a true size or it could be less or different. The nurses' health study also looked at how before the myeloma diagnosis, what is the diet looking like and how does it affect survival after the myeloma diagnosis? And they showed that actually myeloma specific mortality, means risk of death, was 15 to 24% lower for for every standard deviation of the diet for favorable dietary patterns. And all of these patterns are basically fiber-rich patterns in general and healthier patterns. And then the converse was true too, where there was increased mortality for Western diets and inflammatory diets. These are inflammatory dietary patterns. We did a study also looking at this in a large study in the US cohort, and there were over 400,000 participants with 1,400 eventually developing myeloma. What we see is that participants in the highest quartile possibly had about a 17% lower risk of developing myeloma if they had a healthier diet, a healthy plant-based diet index. So the top quartile means the top 25% of people are compared to the bottom 25% for dietary patterns, and then looking at association. We also looked at this with MGUS, and we see a similar pattern that MGUS, sugary drinks, artificially sweetened, naturally sweetened, possibly increased the risk of MGUS by about 40 to 60%, whereas whole grains, fruits, and vegetables lowered the risk by about similar amounts. We talked about elevated BMI in general, but the risk when participants have MGUS or the precancer state and then followed over time, what they see in these two studies is very consistent, is that the participants with normal weight have a lower likelihood of progressing from MGUS to myeloma compared to those with an elevated BMI. And you can see here that when we say this is 2, that means it's twice as likely to progress compared to the normal weight. And you see a similar pattern here with this study too, suggesting that the risk of progression is twice as much for an elevated BMI compared to a normal BMI. So knowing all these things we know, remember they are all association studies, meaning we have not really intervened. We've just looked at populations and said, what's the association between BMI and diet and risk? So we thought that this was an opportunity to study this as an intervention in precancer states like MGUS and smoldering myeloma, as we know that as the disease progresses, there's progressive immune dysfunction, and these factors, as I showed you, affect immune function. So is it possible to tilt the scale or reduce risk of development? This was the trial that we conducted and has completed now, but this is 12 weeks of a high fiber plant-based diet for participants with MGUS or smoldering myeloma precancer states not on treatment who had an elevated BMI. We shipped them 12 frozen meals per week for 12 weeks, and they were eating to satiety, so we did not calorie restrict, and we followed them for 1 year. They got coaching for 24 weeks on the study. We were mainly looking at, is this feasible? Are patients able to do it? Does it lead to some weight loss? But we wanted to look at other aspects too. So what we saw is that this was very feasible, and you can see that when we calculate the adherence and counting unprocessed plant foods, most of the participants' diet was about 20% of their calories being unprocessed plant foods. 12 weeks later and on the intervention, you can see most of their calories are now coming from unprocessed plant foods. And 1 year later, even after we stopped providing food and coaching, they're still much higher than where they started, suggesting that they've maintained many of these changes long term. You can also see that the weight dropped by 7% and maintained 1 year later too. Quality of life went up too, so the patients felt better. This is a way we survey patients to see how they're feeling, and you can see they felt better too. We asked them how difficult was it, and since we are providing food, we're providing coaching, surprisingly, none of the patients who responded said it was difficult, telling us that when we do provide support, it is possible. You can also see that participants had improvements. The green bars tells you the percentage of participants who had improvements in these different symptoms, and you can see metabolic symptoms like weight, cholesterol, hypertension, diabetes, but also energy, sleep, diarrhea, GI issues, arthritis. What's more is 4 participants were able to stop medications too, saving money per month as well from prescriptions. This is very exploratory, meaning early data, because it's not possible to was not possible to show it in all patients, but we had a few patients who had clearly rising protein before going on the study for the 20 months prior, and then once they went on the study, you could see potentially that this may have slowed progression. The rest of the patients had stable disease or very low disease burden, so it was hard to actually quantify the amount, or they were newly diagnosed, so there was limited data in the beginning. Moving on to thinking about these markers that we know are associated with cancer risk. So insulin levels are one thing that we know also may drive risk of cancer, as I showed you. So actually on the diet, insulin levels dropped. We were not reducing carbohydrate intake. They were eating similar amounts of carbohydrate. They were just shifting from eating refined carbohydrates to complex carbohydrates. And with that, you can see that insulin levels dropped. Complex carbohydrates are things like whole grains, beans, seeds, nuts, fruits, vegetables, and refined would be things like sugars, candy, cake, cookies, and processed foods. Diversity, remember we talked about the microbiome and diversity. So higher diversity is generally considered better. And you can see that the diversity actually improved. So the microbiome health also changed over time. These butyrate, the molecule that the bacteria make, the butyrate, these bacteria that make it also increase, suggesting again a shift in the microbiome. What's more is we saw a drop in CRP levels, so that's a marker of inflammation. There were some patients who this level was elevated, and we saw a significant improvement. We also saw an improvement in neutrophil count. So these are basically white cells that are circulating, and when there's less inflammation, there are going to be less of these neutrophils circulating, suggesting enhanced, less inflammation. And this is also just different immune cells in the blood shifted, suggesting a shift in the immune pattern too, just with the diet. This slide, I just want to highlight one thing, is that we looked at the bone marrow before and after the diet 1 year apart. All the green lines are basically after the diet 1 year later, and the gray lines are before the diet. And you can see that again, there is a shift in some of these cell groups, which are associated with anti-inflammatory aspects and suggesting there's innate, like immune potential in the bone marrow, but it's just not circulating. And when you look at this, just think about each line as a communication between two cell groups. And all the cells in the blue are one type of cells or group of cells called myeloid cells. These cells, if you can look at all the gray lines and just focus on that, you will see that the majority of these cells are communicating or talking to these exhausted cells or T cells. Now, 1 year later, we see that these lines are actually more concentrated around the cytotoxic T cells and the natural killer cells, suggesting a shift in the immune system to different cells and enhanced focus on that. This was one participant on our original study. Of course, this is with permission, but he was able to lose weight, stop insulin for diabetes, and possibly also delay progression. We also looked at this in mice to basically say, is it possible to actually do this to understand mechanisms around this? And in mice, because it's a much shorter duration, you can actually look at survival, you can look at different aspects and mechanisms. What we did is the mice were actually, they were given smoldering myeloma. Once they were diagnosed with smoldering myeloma, half the mice received a high fiber diet and the other half received a standard diet, which is basically standard mouse diet, not a Western diet. And then they were followed over time until 30 weeks and to see how many of them actually progressed from smoldering myeloma to myeloma. And what you can see here is that this is a survival curve, meaning how many are alive at 30 weeks. You can see that in the standard diet, all of them had progressed from smoldering myeloma to myeloma, whereas in the high fiber diet, half of the mice had not progressed. We are currently enrolling on some studies, and if you're interested, you can reach out. This study is actually, we're just closing it now this week, but this is a study that was open through the Health Tree Foundation, and we were looking at a very short intervention in MGUS and smoldering myeloma patients to understand how these different interventions affect the microbiome. This study is still very much enrolling and likely to enroll at least until the end of the year. This study does require about 4 to 6 visits to either New York City or New Jersey or Atlanta. You can reach out if you'd like to. We've had multiple participants actually come from other states as well. This is also for MGUS smoldering. It's very similar to the NUTRIVENTION trial, but in this study, we are looking at the diet versus some supplements versus placebo supplements, and all participants eventually get the diet. You can reach out at this email. We also have a study that has actually opened literally this week looking at clonal hematopoiesis. So if you know somebody diagnosed with clonal hematopoiesis who might be interested, they can also reach out to us. That is a condition that increases the risk for leukemia. It's similar to MGUS for myeloma. We think about clonal hematopoiesis for leukemia. And now we've talked about in the prevention setting, so before cancer develops, can we see an association? Now, in the treatment setting, so once somebody has cancer, is it possible really to help patients actually improve response, survival, quality of life with dietary changes? And what you can see here is these molecules, the short chain fatty acids made by the bacteria, they go down as a person is diagnosed from MGUS to newly diagnosed myeloma. But you can see that when a patient with myeloma responds, so this is complete response myeloma, the levels are higher in those that respond compared to newly diagnosed. And they did this in 2 different groups of patients and saw the same thing in this study. So this is our newly diagnosed study. we've designed it such based on the experience from prior studies where participants don't always want to travel, and we want to bring the intervention to where patients live. So as long as a participant or patients in the United States and interested in taking part, they need to reach out to us quite early. So as soon as they're diagnosed, it's better to reach out. But if you already have started treatment, we need the participant to reach out before cycle 1, day 21. So within the first 2 to 3 weeks of starting their treatment. Usually most myeloma patients get 4 drugs, these combination of 4 drugs. And so only participants who are getting these 4 drugs are able to go on the study. We're not enrolling any other drug combinations. But if you have, somebody who's diagnosed recently with myeloma or might be interested, they can reach out. We are not enrolling at all centers across the country, but this is a decentralized study, meaning that we are aiming to, as long as the participant is getting treatment at an academic center that uses EPIC, we can work with you to figure out what's possible and what, if you are interested. So do reach out and we can talk more. The study is very short. It's only 12 weeks where we give half the participants food and the other half we actually provide gift cards and meeting with the dietitian after 12 weeks, because we're trying to understand if we make dietary changes during chemotherapy or we make the changes after chemotherapy, is there a difference in outcomes for patients? And we don't really know that yet for newly diagnosed myeloma, so this study will help us answer those questions that many of you may have. And then thinking about the survivorship space, so like after initial treatments done, patients on maintenance or relapse, can it be that lifestyle changes, dietary changes could actually increase the time to the first relapse? And so we had done this study actually now quite a few years ago, but participants who were on lenalidomide maintenance, while they had finished their initial chemotherapy, some got transplant and now they were on maintenance therapy. What we saw is that the participants who had higher microbiome diversity, higher butyrate producers, and higher butyrate concentrations in the stool were more likely to actually be in remission or sustained MRD negative, meaning that absence of myeloma over 2 time points a year apart, the best kind of response. We see that the microbiome actually correlated with it. And then further, we actually had these participants fill out dietary surveys too, and we saw that there is an association between healthier proteins and also dietary flavonoids, which I told you are plant chemicals, suggesting again that dietary patterns may affect the microbiome and through these different immune pathways maybe enhance control of disease or cancer. We have this study that's currently enrolling, not currently enrolling, currently being analyzed. The study is completed enrolling, but this is a study with participants who had finished the induction and transplant and were on maintenance. Half the participants were on lenalidomide and the other half on daratumumab. A subgroup of the participants actually received the dietary intervention, and we are now analyzing this data. Hopefully within a year or so, we'll be able to share some updates on how do participants who make dietary changes while they're on maintenance therapy do, and does it make a difference? I already showed you this, but microbiome features like diversity correlate with survival. The higher diversity are actually ones who do better long term. So we've just talked about many effects of how diet could affect the microbiome, metabolism, immunity, and cancer. So some of the mechanisms is through weight, through insulin resistance, through the gut microbiome and gut function, inflammation, the immune system, and then maybe directly affecting cancer cells through these short chain fatty acids. Sources of dietary fiber, I just wanted to highlight given sometimes people may be confused. Here are some practical dietary tips to consider. Of course, it needs to be individualized, and every patient, everything may not work for everybody. So I want you to discuss it with your own team or dietitian and see what's right for you. I think it's important to focus on unrefined and whole grains. So we want to always eliminate or reduce refined carbohydrates, but whole grains are considered healthy and reduce cancer risk. So think about them. Those are things like buckwheat, quinoa, barley, whole wheat. All of those are whole grains. Brown rice, black rice. Fiber intake, try to improve that. Change, picking sources of protein that are more plant forward can also help because they give you both protein and fiber, such as beans, tofu, tempeh. Thinking about more unsaturated fats and maybe potentially adding fermented foods too. These are some supplements that I think, you're just checking levels with your doctor, or if you're 100% plant-based, thinking about taking a weekly B12, since B12 comes from the soil microorganisms. And when we don't eat animals, we don't get it because they are either getting it during animal agriculture or they get it from eating the dirt in the soil. Thinking about also calorie counting and calorie restriction, I find is very difficult to sustain long term for people. So it's more important to change diet quality and pattern than trying to focus only on calorie counting. It also helps to plan in advance, because if we've not planned in advance and we try to pick something at the last minute, then we are always going to be very hungry and make less good choices. Thinking about hydrating well, regular meal times, learning to read ingredient lists and nutrition labels, and gradual changes are more sustainable. Um, I think frozen fruits and vegetables and canned beans and other aspects can be just as healthy. Often people may say, I'm not close to a grocery store, I don't have time to go buy fresh fruits and vegetables daily. That's not a problem. You can just buy frozen fruits and vegetables and then you have them stocked in your freezer for whenever you need. It doesn't have to just be raw salads, and cooked foods can be healthy too. So I just wanted to give you an example of where fiber comes from, and just showing you a Western diet and a high fiber diet. And you can see that in this Western diet, the only source of fiber is basically the bag of broccoli and the potato, but there's really very little fiber. Whereas with a high fiber diet, all foods have fiber rich foods and increasing that. If you say, okay, what about if you're telling people to eat all this fiber, what about their protein? Are they going to get enough protein? I want to also bring your attention to where protein comes from. All foods have carbohydrates, protein, and fats. It's just a proportion. And so even fiber rich foods have quite a bit of protein. As you can see, 1 cup of lentils gives you 18 grams of protein plus about 15 to 20 grams of fiber. So thinking about that, it is possible to achieve the goals for protein intake as well on a high fiber diet. I want to emphasize that nutrition changes, of course, need to be individualized. I'm not saying that everybody needs to do all of this at once. And we are studying this in the newly diagnosed space and on maintenance, but it has to be personalized to what is possible. Sometimes it might be overwhelming when you're already going through treatment and lots of other things. So at that point, maybe it's better to focus on the treatment and then maybe later think about it. I think every person is different and we have to see what's right for that patient. Also medical issues, so we might say change diet, but if a person's not being able to eat enough because of nausea or diarrhea and they're not tolerating foods, then we might need to focus more on what they can get their calories in from. Also medical issues, many of these can also be helped, as I showed you, through dietary changes. And some people do better with making gradual changes, and some do better with drastic changes, like change everything overnight. But I think if you haven't really planned it and thought about it, you can actually feel more hungry and then say like, this doesn't work, it makes me feel worse. And that's the important thing. When we're eating fiber rich foods, they are lower in calories, so we actually increase consumption of food, but at the same time we're eating less calories. And sometimes when people switch, they don't realize that and might be eating too less and then feel like they're not filled enough or satiated. It doesn't have to be salads and raw fruits and vegetables alone. I think you can think about everything that you typically might eat and then say, how do I just change it to make it a more healthier version? So if you're going to have a stew with meat in it, maybe you can sometimes switch it out to putting tofu in there, and then you get the fiber. So you're making small swaps that can over time add up. And some foods that may be higher in protein as well as fiber, just a list of things. Of course, these are things just to think about when you add in. Another thing is, if people aren't able to get the calories in, thinking about smoothies, because sometimes drinking calories can give you more calories. This is not needed for people who are trying to lose weight, but more if you're trying to gain weight or maintain weight. And thinking about calorie density. So like if you try to eat a salad with spinach, you're going to get maybe, I don't know, 50 leaves or like a small amount. But if you cook spinach, because it shrinks and all of that, you're going to eat more of it. So often cooked foods, you are able to bring in more calories, and that's another way of increasing consumption of it. I just wanted to bring up, this is the last slide of, when I've given some of these talks in the past, patients have come together as support groups and then thought about like, okay, how many plants do I eat, and make it a game and challenge for each other. And you can see that they've basically every day would write down the different plant foods they've eaten and track it. So that's one thing you could do and think about too. So with that, I'd really like to thank my core NUTRIVENTION team, who really helped me with all of this research. And this would not be possible without the support of collaborators, the patients who take part, the funding sources. And this is the QR code to the paper if you were interested. So with that, I'm happy to take questions, and thank you all for listening.
Thank you so much, Dr. Shah. That will conclude our presentation, and we'll transition to the Q&A session. We'll address the questions that were submitted during registration, as well as some of those added to the Q&A box today. To moderate our Q&A, I would like to welcome our registered dietitian at Blood Cancer United, Heather Knutson.
Thank you, Ellie. And we received a lot of really great questions. And thank you to everyone who took the time to submit a question. We'll answer as many questions as we can here in the time we have available. And thank you for taking questions today, Dr. Shah. Would you be able to share how you define processed foods? Maybe thinking about like whole wheat berries versus whole wheat pasta or things of that nature.
Yeah, I think minimally processed foods can sometimes help with convenience, and they aren't unhealthy. They can actually be pretty healthy. So think about something like soy milk. Soy milk would be considered a minimally processed food. Tofu is minimally processed because you're not eating the bean alone, but it's a processed food. But those are actually minimally processed and healthy and can be part of a very nutritious diet. But on the other hand, if you're taking things like cereal, like Cheerios, or any of these frosted flakes, those are more ultra processed with added sugar, other aspects. And those I think we want to try to limit to the best we can. So I think thinking about not just saying that, okay, I'm going to only take out all processed foods, but thinking clearly about like ingredients, labels. For example, sugar. The average US population, a person takes in about 17 to 19 teaspoons of sugar. If we could try to at least bring that down to less than 6 teaspoons, when you look at an ingredient label, if you see for every 3.5 to 4 grams of sugar, that's 1 teaspoon. So if you're going to eat something with 12 grams of sugar, you've got your 3 teaspoons there. So if you can think about limiting that to less than 6 to 9, that in itself is a way to improve and reduce the ultra processed foods.
Yeah, thank you. I think sometimes that word process can be a little bit confusing. And where is
Yeah.
that line? Thank you. And thank you for bringing up sugar. And I'm sure you've heard the question quite frequently, that sugar feeds cancer. Can you comment on that and give a little bit of insight?
Yeah, so
Statement.
I alluded to it in the talk, but
Mhm.
when you think about the like sugar feeds cancer, remember cancer cells are like all the other cells are going to basically take whatever nutrients uh, we have. So if it's not sugar, it may be a protein, it may be fat, it may use other aspects too. But why we want to limit sugar is not just because it feeds cancer directly, but because indirectly more sugar leads to inflammation, and more inflammation leads to increased risk of cancers and worse outcomes, as we have shown in the studies. So I think limiting refined sugars to less than 6 teaspoons or as low as you can is always going to help you. A lot of the sugar we eat is hidden. Like if you're buying a coffee or like a donut, you don't realize how many there are in it. So that's one place, you can think about cutting. Even cereal often has a lot of sugar.
Yeah, good point.
And
Uh,
sorry, just to add one
yeah,
thing, and it's very important, I think, to not throw the baby out with the bathwater in a way. Is like when we people think sugar feeds cancer, they assume carbohydrates are bad and carbohydrates should not be eaten. So what ends up happening is that they avoid all fruits, whole grains, vegetables, and all of that, and those are all healthy foods. So I think if you can avoid refined sugars but increase complex carbohydrates, that is very different on what it does to the body compared to refined sugars or refined carbohydrates.
yeah, wonderful. And on that same note, we received a lot of different questions about specific foods or very individualized difference versus all eating pattern followed.
Sorry, I missed part
Oh,
of it, but you're
oops,
saying there's a
oops. Can you hear me now?
yes.
Okay, I'm sorry. Um, Asking about the difference between how much difference does individual foods make on a diet, like eating fruit or green tea or beans specifically versus the overall big picture of their eating pattern.
I think the big picture eating pattern is much more important than just one food. So often people say, oh, are
Mhm.
mushrooms healthy or is beans healthy or which is the one food I need to eat? And I think that trying to, think about your plate and bringing majority of the calories coming from these fiber-rich foods and
Mhm.
colorful plate, like that's where the majority is going to come. It depends. Some people may do it 100%, some may do it 80%, but I think when we get the majority from it, that's where we are going to see the benefit. And depending on individualization on what a patient needs based on their preferences and health conditions too. So I think it's more important to think about the pattern than an individual food. With green tea, I think there was a question, and like there is some data that actually a lot of green tea might affect the effectiveness of bortezomib, one of the drugs, and so we asked to limit it while you're on that drug. The reason we know that is because somebody studied that. It is possible that it limits it for another drug, but it may not have been studied. I think drinking green tea occasionally, and it's a healthy uh, food, and I would not say you shouldn't. But I think if we're doing like very high doses, pills, any of that, then I think we start getting into more problems.
Sure. Thank you. We had several participants ask about navigating side effects such as diarrhea while trying to eat more high fiber foods. What advice would you give to patients working to make diet changes while experiencing different side effects that maybe make that a little bit challenging?
So I think lenalidomide is one of the drugs that actually increase diarrhea in myeloma patients and is one of the um, key factors. We have studied that diarrhea and the microbiome and the food groups associated with it, and we do see that um, because it's a bile acid diarrhea, more fatty foods and saturated fat seems to be associated with it, and maybe fiber rich reduces it. But that's a small number of patients, and we're still analyzing that. I think that we have to individualize it to see what works for you, but fermented foods can be a really good way to help with the microbiome. It's often because treatment has led to, perturbation of it, and that can help with reducing diarrhea too. So if you do have a lot of diarrhea and it's not related to lenalidomide, which, for lenalidomide, you could think about the Welchol or the drugs that can bind bile acids, but also think about some of these dietary patterns we talked about. And then I think in general, you can think about fermented foods to help with reducing it too, and that could be one way. I think it's hard to answer this in general because we need to individualize it to each person and see what works.
That's a very good point.
And
Thank you.
one more thing to add is like people think that if they're having two stool a day, they maybe are having diarrhea. But remember
Oh,
that when we eat fiber-rich foods, we are going to have more bowel movements, and it is normal to have up to 3 bowel movements a day. And when we are eating less fiber-rich foods, often people may not have a bowel movement in a few days, like one in a few days. So up to 3 a day is normal, unless it's really watery. You want to, of course, rule out infections and other aspects.
wonderful. Thank you. Um, and we had a lot of questions about the microbiome and if it is helpful to take supplements for prebiotics or probiotics, or if it's better to consume those from whole foods.
It's a great question. I think that whole foods seems to be where most of the data is. Prebiotics, remember that when you eat a whole food, you're getting many, many types of fiber. So, like you'll get cellulose, inulin, pectin. These are all types of fibers within different foods, and you get a variety. Each fiber probably feeds different bacteria, and that's how we get this diversity. Often, when we eat a fiber supplement or have it, we're getting only one type of fiber, and that may actually reduce diversity, or in some studies have also been associated with inflammation. So, I would say that if somebody is really not willing to make any changes, then they want to try a fiber supplement, they could, though there's very little data with that. But I think if you can do it with a dietary pattern, that's probably better.
Mhm. I always think too, it's more fun to eat food than
Yeah.
take pills.
That's very true. That's a very good point.
Yes, thank you. And thank you for taking the time today to answer all of these questions and for a really wonderful program, Dr. Shah. We appreciate you being here today.
Thank you so much for moderating, Heather and Ellie, and it's been a pleasure to be with you all, and look forward to continuing the conversation with patients and the community alike.
Yes, likewise. Thank you. And we're going to wrap up the Q&A portion here and close out the program with a few final thoughts. The Nutrition Education Service Center, a program of Blood Cancer United, is a free nationwide resource dedicated to supporting patients and caregivers with nutrition education. Our services are designed to help individuals navigate the complexities of nutrition during and after cancer treatment, as well as manage side effects and promote long-term health and survivorship. I encourage you to visit our website, www.bloodcancerunitednutrition.org, for a comprehensive look at all that we offer. You'll find a wealth of information about our free consultations and our library of articles, videos, and guides on topics like nutrition by diagnosis, food safety, and caregiver support. In addition, Blood Cancer United offers free booklets, fact sheets, and one-pagers, our most popular being the Nutrition Handbook. You can download them or request free copies by mail through our website, listed on the slide. Education Service, take a moment to explore the resources available to you. Online chats, educational videos, podcasts, financial resources, booklets, and more. Visit www.bloodcancerunited.org/patient support to learn about all of these offerings. Blood Cancer United Information Specialists are US-based, highly trained, licensed oncology social workers and nurses who are ready to help you or your loved ones navigate a blood cancer diagnosis and connect you to financial and social support information. You can find their contact information on the screen, and again, these slides will be available to you shortly after today's program. You can also download the Blood Cancer United Health Manager app to track your meals, symptoms, medications, and even questions for your doctor. These resources are designed to make daily life a little easier and to help you feel more confident in managing your health. Thank you so much for joining us today for Dietary, Microbiome, and Metabolism Evidence in Blood Cancers, Focus on Myeloma. We hope you found this program helpful and that you will leave with new information and resources. Your feedback is really helpful for us in planning future programs. A short survey will be included in the follow-up email, or you may scan the QR code on the slide at this time. Please take a few minutes to share your thoughts so we can continue improving and offering programs that matter to you. On behalf of Blood Cancer United and the Nutrition Education Services Center, thank you again for spending your time with us today. We wish you all the best on your path to health and wellness.